Welcome back. Workers with headache problems and migraines stay away from work too often, and this affects their job. The International Migraine Awareness Week takes place until the end of the week with focus on public servants. The aim is to raise awareness of this much misunderstood condition and to encourage those affected to seek information and advice. To mark International Migraine Awareness Week, the Migraine Research Institute and the Headache Clinic have launched a new community service for both South African police personnel and registered nursing staff. Dr. Elliot Shevel, chairman of the South African Headache Society and founder of the Headache Clinic, joins us in the studio to talk about this. A very good morning to you and welcome, Doctor.
Good morning, thank you.
What's the difference between headaches and migraines?
Migraine is more what they call a vascular condition. In other words, the pain comes from the blood vessels, whereas an ordinary, what they call an ordinary headache, is more a muscle tension headache.
So then, you'll be leading a debate on the origins of the causes of migraines.
Yes.
Basically, I mean, what has been found so far about these causes?
Well, the big problem is up to now, people have thought that the cause of where the pain comes from in migraine is that the blood vessels in the brain are stretched or distended, and that causes the pain. But about a year ago, some Dutch workers, neurologists, found that the blood vessels in the brain are not dilated at all during migraine. And what we've been saying here at the Headache Clinic is that the pain doesn't come from the vessels inside the brain, it comes from the vessels outside, under the skin. And this is proven that we're correct. So it's a big leap forward for us, and that's what this debate is about in Prague next month, where we will be debating about the extracranial, that's the arteries on the outside, and intracranial. But the evidence is there. It comes from the arteries on the outside.
From the Headache Clinic's experience, people have been consulting, they're coming with all sorts of problems concerning migraines. How do they get affected, and what have you realized regarding how prolonged the condition lasts?
Well, migraine, it's a condition that you can have for years and years and years. Some people it burns itself out, but others it just gets worse and worse and worse. And when you mention the workplace, it's quite easy for people to understand, well, they had 10 days off work this year. But that's not the main problem. The main problem is that migraine and headache sufferers, because they don't want to be seen to be taking off work a lot, they go to work with their migraine or with their headache. So what happens is that their productivity while they're at work is affected, but that's very difficult to measure. Now we have a test that one can do, which if one goes onto the Headache Clinic website, it's a free test. It takes about 5 minutes, and it's scientifically accurate. It shows what percentage effectivity you are working at while you're at work with the headache. And it's frightening. People have a 20 or 30% effectivity at work.
Does it mean that what you do at work has a certain influence to a certain extent on the condition that you have?
Yes, well, stress is one of the big triggers for migraine. It's not an underlying cause, but it's a trigger. And so if you're in a stressful work situation, or if one is sitting badly in front of the computer, your posture is wrong, or if you're in driving, if you drive in the wrong position, all those things can trigger off the thing. But the big problem here is to find the underlying cause, where the pain is coming from.
Well, talking about stress, I mean, I would imagine the traumatizing conditions that the police and nursing staff and other people who are public servants, even in the private sector, work under. So tell us a little bit about your program concerning the police and the nurses.
Well, we recognize that these people work under tremendous stress, and they give a lot to the community. So we decided that to help them, we would give them a substantial reduction in the cost of our services, a 50% reduction.
Let me understand this before we part ways. If I have a headache, should I suspect that it may cascade down to now the condition of a migraine?
You suspect?
Should I suspect that I may end up having migraines if I have headaches?
All right. You know, this is Migraine Awareness Week. There are three main things that I'd like to get across. Firstly, people say, oh, it's a normal headache. There's no such thing. If you have any kind of headache, you must actually have it diagnosed as to what's causing it. Number two, people shouldn't be taking medication for headaches because the medication makes it worse. But the third and most important thing about Migraine Awareness Week is that the good news is that now we can actually do something about them because of the wonderful advances in treatment that we've managed to.
Just very briefly, we've had people saying that when they have not eaten, or maybe if they've had a drinking bout the previous night, having a babalas and all that, they would be having headaches and all that. Should that be attributed to the condition as well?
Well, you know, if you have the odd babalas, it doesn't need treating. It's when you have repeated headaches, ongoing, and you have to take medication often.
Okay, thank you very much for talking to us, Dr. Shevel. That's Dr. Shevel, who is the founder of the Headache Clinic and of the South African Headache Society, talking to us right here on World Today. We'll now take a look at what the weather